Osteoporosis, often called the silent disease, develops quietly and without warning until a fracture occurs, transforming a hidden condition into a life-altering event. Imagine bones so fragile that a simple sneeze or minor fall could lead to a fracture, disrupting daily life and independence. This chronic condition, characterized by the gradual weakening of bone density, affects millions worldwide, yet it often remains undiagnosed until it's too late. Its impact extends beyond physical health, influencing emotional well-being, mobility, and quality of life. Understanding the symptoms of osteoporosis is crucial, as early detection can be the key to preventing debilitating fractures and reclaiming control over one's health. Before we get started, be sure to subscribe and give this video a thumbs up if you're ready to explore with us. Number 1. Weak grip. Having trouble opening a jar lately? Finding it harder to squeeze a lemon? These little challenges could mean more than you think. Osteoporosis, a condition that reduces bone mineral density, BMD, often manifests itself in a weaker grip, an early but often overlooked indicator of declining bone health. Studies have consistently shown a link between poor grip strength and osteoporosis. Research published in the Journal of Bone and Mineral Research found that older women with reduced grip strength had significantly lower BMD, particularly in critical areas such as the hip and spine, which are common fracture sites. Similarly, a study in rheumatology confirmed that low grip strength in women was associated with reduced BMD at these sites and a higher risk of vertebral fractures. Poor grip strength may also signal an increased risk of falls, a major cause of fractures in people with osteoporosis. Recognizing weak grip strength as a potential symptom of osteoporosis provides an opportunity for early diagnosis and timely intervention to help prevent fractures and protect your overall bone health. Number 2. Gum receding. Most people associate osteoporosis with fractures in areas such as the hip and wrist, but the jawbone, which supports the teeth, can also be affected. Gum receding, often associated with gum disease or aging, can also be an overlooked symptom of osteoporosis. As osteoporosis weakens bones throughout the body, it can also affect the jawbone, which supports the teeth. When the jawbone loses density, it can cause the gums to recede, exposing more of the tooth and its roots. This link is particularly important for women, especially postmenopausal women, who are at higher risk of osteoporosis and may experience changes in their dental health. Gum receding is not just a cosmetic issue. It can be a sign of declining bone health and warrants further investigation. If you notice your gums receding or your teeth moving, it's worth seeing both a dentist and a healthcare professional. Early detection of osteoporosis through signs such as receding gums can lead to timely treatment, helping to protect both your bones and overall oral health. Number 3. Hearing loss. Hearing loss may not be the first symptom associated with osteoporosis, but research has uncovered a significant link between the two. A study published in the Journal of Clinical Endocrinology and Metabolism found that people with osteoporosis face a higher risk of developing sudden sensorineural hearing loss. Similarly, research published in the Journal of Bone and Mineral Metabolism indicates that reduced bone density in the cochlea, a key part of the inner ear, can disrupt sound transmission and contribute to hearing loss. The middle ear contains 3 tiny bones, the malleus, incus, and stapes, that are responsible for transmitting sound. Osteoporosis, which weakens bones throughout the body, can also affect these delicate structures. Over time, demineralization of the ossicles due to osteoporosis can lead to conductive hearing loss. This risk is particularly elevated in postmenopausal women, who are more susceptible to both osteoporosis and related hearing problems. If you or someone you know is experiencing unexplained hearing loss, especially if it is accompanied by other symptoms of osteoporosis, it is important to seek medical advice. Recognizing hearing loss as a potential symptom can pave the way for earlier diagnosis and effective treatment, protecting both hearing and bone health. Number 4. Back pain. Back pain, often attributed to aging or poor posture, can be a key symptom of osteoporosis too. As osteoporosis weakens bones, the vertebrae in the spine become particularly vulnerable. Tiny fractures, known as compression fractures, can develop in these weakened vertebrae, causing persistent or sudden back pain. This pain can start gradually or occur abruptly, even after minimal strain, such as bending over or lifting a light object. Research published in the Journal of Family Medicine and Primary Care shows that back pain is very common in people with osteoporosis, especially women, and has a significant impact on their quality of life. If you're experiencing unexplained back pain, especially if it coincides with changes in posture or height, it's important to see a healthcare professional. Identifying back pain as a symptom of osteoporosis allows for timely intervention, preventing further complications and improving overall well-being. Number 5. Kyphosis. Kyphosis, a forward curvature of the upper spine that causes a hunched or stooped posture, is often a visible symptom of osteoporosis. As osteoporosis weakens the vertebrae, they can collapse or compress, resulting in this characteristic curvature. Research in the Journal of Bone and Mineral Research highlights that cervical and thoracic vertebral fractures caused by osteoporosis are significant contributors to kyphosis, which progressively weakens the structural integrity of the spine. This symptom can cause severe pain or, in some cases, no pain at all, making it easy to overlook. Seeking medical advice can ensure a proper diagnosis and appropriate treatment to prevent further complications and maintain quality of life. This concludes the first part of our series on the 10 early signs of osteoporosis. If you found this video helpful, we'd greatly appreciate it if you could like and subscribe to support our channel. If you have any questions or thoughts, feel free to share them in the comments below. Be sure to stay tuned for the next video in this series. Thank you for watching.